every day, just a few minutes of thoughts and interaction. And I will be monitoring your comments here, those of you that are on Periscope and Facebook Live. I will try to respond to questions that come up on the stream here. And also a reminder that we have the interactive show on Sunday. Do we have a time for that, like 3 o'clock or so? 3 o'clock, Jason Ellis will be my guest on Sunday. And again, that's with call-ins. That's the Ask Dr. Drew show. And then again at 5 o'clock with Scott Adams, we'll hear some of his New Year predictions. He's pretty good at predicting things. For some reason, I'm not seeing the chat, so I'm wondering if I'm getting them. I'm just refreshing it now. So please do put your comments up here, and I'll try to address your questions that come up on the Facebook Live and on the Periscope. Yes, Ms. Producer, I hear your voice.
They're coming up.
Oh, there they are. Talk about the difference between men and women with borderline personality disorder. So let me, before I get real specific stuff like that. Hi, guys. Hey, what's the training looking like? Same old stuff. Hi, Matt. Good to hear from you. Hi, Shannon. Weird world situation, right? Violence again in the world where the U.S. Military has intervened and killed an Iranian leader. I have very strange and mixed feelings about it. As a clinician, it's really hard to advocate for violence, and yet I have an intellectual understanding of what this is all about, and that if indeed other lives are to be saved, and this is someone who is maintaining a campaign against us, I don't know what else they could have done. One more year schooling for nursing, and then I'm done. My family is toxic. Should I deal? That is from Nicole. Nicole, thank you for doing nursing. More nurses, please. You have no idea the importance that nursing is going to play in the next 20 years. Secondly, toxic family, you may not have much control over that, and so I'm not so sure you should really do anything just yet until you have a lot of autonomy away from them, and then their toxicity is their problem and may not be something you can do something about. Sober and clean off opiates with methadone but have terrible cocaine cravings. Darlene, that's my grave concern about replacement therapies, is that it doesn't do much for the other addictive substances, and you are not typically carefully monitored for some of the other things you can get into. I understand the usual suspects, amphetamine, cocaine, whatnot, they will monitor you for. But there's a lot of other things out there these days that people are getting into. And methadone in the high doses, which would take away some of the cocaine cravings, lays you out. I mean, it just ruins your life. You're on the couch, essentially, so you don't really want to do that. How about going to meetings and doing the things that you're supposed to do to manage cravings? See, the problem is when you're on replacement therapy, you're not as motivated to do the hard work of recovery, which is hard work. And that's one of my concerns about replacement. I myself am going to be X certified to give replacement therapies. So I'm not saying they're bad. I'm not saying they shouldn't be used. I'm saying, you're asking about a problem you're having. Maybe there's a better way to do this. And one of the ways, by the way, is to switch over to buprenorphine. You're on 40 milligrams, Darlene, yeah, and that's a good dose, and you don't want to take more than that if you possibly can. And if you can get down to about 30, you can switch over to buprenorphine. You might want to try that. What is the status of the homeless situation in California? Angela, the problem is getting so worse. Thank you for your help. Yes, the problem is getting so worse. It's on my mind all the time. I'm going up to Sacramento in about a week to give a talk about the history of how we got into this mess. Housing is not the problem. Look, we have multiple populations of homelessness. Read the book American Psychosis if you want to understand how we got into this catastrophic mess. And I don't want to keep harping on it every time I go live with a podcast or with a stream, but it's such a massive problem. There is a new model out there that thankfully many cities are contemplating using, called the Trieste model, which is the Italian city of Trieste. Guess what? Has a psychiatric model of treatment for dealing with their homelessness. All kinds of careful rhetoric built around it where you're not allowed to call it psychiatric care, but it's exactly what it is. But at its core, much like with recovering from addiction, which is what I build as recovering communities, it's a community-based model with lots of structure and lots of accountability and lots of vocational rehab and lots of psychiatric and psychological services, and that will work. Problem is, we're going to have, and you're talking about it here, Lulu, about the stigma associated with mental illness, is that we are reluctant to put laws in place and actually help us do the work. We have to be able to help the sickest. I had calls just yesterday with a family desperate to help a severely manic patient who was going to kill somebody, and nothing they can do until he does something horrible. as opposed to this person is clearly mentally ill. Let's put them on a conservatorship, temporary or otherwise, get them stabilized. When they come out of their illness, their what's called anosognosia clears. Anosognosia is the thing that blocks your insight. Stroke patients have it, dementia patients have it, mental illness, addiction. You know why 90% of drug addicts don't receive treatment? 90%. And when you interview that 90%, 80% of them, when you ask them, why didn't you get treatment? You know what their answer is? I don't need it. Why would I need treatment? That's denial. That's all, and it's so deep. It's actually an anosognosia, which is a biological lack of insight, a block of insight, and we have privileged that in the law. And until we do something about that, we're not going to be able to help people, the really sick people, which are the ones we're concerned about. The transiently homeless, on average, people that are down on their luck, that have the economic strife, that are impaired due to poverty, on average, spend 3 months on the streets because there are lots of resources for those people. But for the seriously mentally ill, you can't do anything. I want to get back to the question about the male versus female borderline personality disorder. Technically, the borderline process is the same. And so, like with every personality issue, it can manifest slightly different in men than in women. I'm not an expert in those differences. I can tell you... my experience has been that the males suffer a bit more. That's about the best way I describe it. It's very hard for them to come to terms with the borderline process. They do also respond to dialectical behavioral therapy, both groups. I just don't know if one responds better than the other. It's not my area of expertise. My ex-husband went through 3 rehabs and went back to drinking and coke years later. Doesn't know how to live any other way. Well, Melanie, the trick is for you to, because addiction, perfect model for addiction is the plant in the little shop of horrors. You know, the plant that eats people. If you go near the plant, you go in the plant, unless you have somebody there pulling you out. And addiction works exactly like that. It uses and deploys everything around the individual with the disease to its advantage. And the only way to break that for you, Melanie, is to go to a program called Al-Anon or get a therapist. But Al-Anon is designed for this, and it's free. I can't say it enough. It is free, and it's on every street corner. Al-Anon, look it up online. They'll come and pick you up. And Al-Anon will help you, give you that cord, that what some people call Ariadne's cord, that cord to pull you out of the plant so you don't get sucked into it. And that will change what he does. Lulu's saying CBT and DBT are great. And I think, Lulu, you asked the question about the borderline personality disorder. Yes, CBT and DBT work very well for borderline process. But so men can have borderline worse. Lulu, I don't want to say that men can have borderline worse. I would just say, in my experience, the male borderlines I've dealt with have really suffered. They've really suffered. And it's borderline is an interesting disorder. When people gain an awareness of it, it makes them at first a little more frustrated. You know, they're more angry with the condition, but they can do a lot with the therapies, as you said. Let's see. NAMI could use someone to speak up on mental illness. Well, NAMI does a good job, the National Alliance for Mental Ill. Also, there's a great, if anybody out there has anxiety disorder, OCD, the IOCDF.org, the International Organization of Obsessive Compulsive Disorder, IOCDF.org, great organization if you have those kinds of illnesses. I have anxiety disorder and sort of OCD spectrum. So for me, meeting up with those people, I spoke at their conference one year, and seeing the tremendous community and the depths of resources they have, a lot happening these days as it pertains to, sorry about that, as it pertains to coming together better around mental illness and reducing stigma. I think it's my computer that does this.
Oh, you didn't hear me tell you to turn your computer
No, I did
off.
Tone my computer for some reason.
That's all right.
Takes my phone calls.
That's all right.
What's the best severe PTSD from? What is best for severe PTSD from childhood abuse? Okay, so Christy, from my position, that is the problem of our time. PTSD, adverse childhood experiences, childhood trauma around sexual abuse, physical abuse, neglect. I mean, that is at the core of so much, including the homelessness problem. And to really, if you're motivated to treat those disorders, you want to They take a long time. Some medication has been a benefit, at least in the short term. Trauma-informed therapies and specific trauma therapies like EMDR or neurobiofeedback, these things are extremely effective, and you should take advantage of that. And then certain group therapies also can be helpful, particularly for people that have been through like an acute trauma, like a combat trauma. If they had previous trauma and then a combat trauma, being around people who understand your experience can be very impactful. Yeah, Melanie, of course I have. Listen, 50% of us have mental illness, right? I had a major depressive episode in college. I had panic attacks. I have generalized anxiety disorder, which is just my biology, and I'm obsessive compulsive disorder, which can be, any of these things can be an advantage. They can be deployed. Once they're not affecting function and they're not affecting your comfort, then they're just qualities you have, and you can learn to focus them, manifest them. Some of these things have great creative potential attached to them. Is there lack of funds for those who need intensive therapy and are on county and state? Well, there's a whole mess there with the IMD exclusion, it's called, where Medicare, Medi-Cal will not treat people that need chronic kinds of care. That's going to change. I've spoken to the administration. They're working on changing that. They have a pilot program going right now in Washington, D.C. Come to Palm Desert. I did, Eileen. I was I spoke at the Eisenhower Hospital in Palm Desert, which is not far from, I guess, is that Palm Desert or is that Rancho Mirage, wherever, somewhere? Any event.
Rancho Mirage.
Yeah, Rancho Mirage. It'll all cost too much money, June says. No, it won't, because we are wasting billions and billions and billions of dollars in a homeless industrial complex that is housing, that is building these high-end condominiums that mentally ill people can't go in. They're not going to go in. You can't fix mental illness with four walls. It just doesn't work like that. So they're going to all have to be staffed like a hospital, and they're too small, and they're not built like a setting that can be like the Trieste plan, which I know the city's finally looking at, but they don't have any plan to implement it until 2021. So hopefully that is something that they will. I don't know, Jesse, what you're talking about, grow a spine. I'm not quite sure what that means.
No, you.
I need to grow a spine in relation to what?
I don't know.
Oh, just clarify that one. Okay, so look for me today. A couple things I want to promote. I'm going to go on the Adam Carolla Show today. I think that will air today. Adam and I have our own podcast together that we're going to start getting going again. Alina wants to know that I talked to administration. There's an executive limb of the government that is functioning. There are secretaries. I've spoken with the secretaries. They are not going. They're not changing, and they are working very hard on this homeless thing.
You're also doing Ask Dr. Drew this weekend.
Ask Dr. Drew at 3 o'clock and 5 o'clock this weekend, and
Jason Ellis and
Scott Adams, and
very diverse.
And we will continue to try to do these on a daily basis for a few minutes. So bring your questions to this thing. Yeah, Scott Adams, I just want to pick his brain on. I found Scott Adams long before anybody else did, and before he became sort of in the political sphere. I'm just interested in his world of persuasion. I always thought, as I said yesterday, I always thought persuasion was logical argument. I thought the Lincoln-Douglas debates were about persuasion, but lo and behold, I learned there's a whole other thing that is out there called persuasion, which is sort of more in the hypnotic field. Somebody asked a question about TMS. Yes. Transcranial magnetic stimulation therapy. I've done several podcasts on TMS. You can find them at drdrew.com, I suspect. And also behind the paywall, the Dr. Drew podcast. I think I've done several there. TMS is great. TMS is essentially a magnet that focuses magnetic energy right in the parts of the brain that are associated with depression. In fact, we did an Ask Dr. Drew about this, did we not?
Yes, we did.
Yes, we did. And so is that up on the website?
It was on depression. It was about 2 weeks ago.
Okay, 2 weeks ago. Is it up now on the website?
Yes, you can go to the website and find it.
That.
It's on depression.
On depression. And
I think it was You Live, so.
They focus the energy, the ECT, electrical convulsive therapy, is essentially sending a general current through the brain and trying to raise chemistry by, essentially, if your brain was a bunch of wires, trying to get the wires to release more energy at their tips, which is the neurochemicals that cause the communication amongst the cells. Well, as opposed to having something with all the side effects and all the sort of dangers of anesthesia and whatnot. This is just focuses the energy right in the spot that we're associated with depression and raising that chemistry there. Because if you understand how sort of the physics works, is that magnetic fields cause currents. They right down the middle, currents. And so those currents are what we're sending down the cells to cause the neurochemicals to release. Oh, yeah, Darlene, thank you for bringing up Nick Gordon. So let me finish with this. Nick Gordon was Christina, I'm blanking on her name. Okay.
Aguilera?
No. Whitney Houston's daughter, Christina.
Houston.
No, that was her name. But Brown, I think she's
Brown.
Bobby Brown, Christina, and Whitney Houston's daughter. She died of addiction. Let's be clear. That was severe. There was an accident probably, but there was addiction. You know, addicts die not just because they take a needle and inject it into their arm and overdose themselves. They die because of the infectious diseases. They die because of fights. They die because of falling. They die because of drowning. It's all addictive deaths, right? And she died around addiction. Her boyfriend, Nick Gordon, was clearly in serious trouble. And if you remember, he did an interview with Dr. Phil back soon after Christina's death, and he was out of his mind psychiatrically and with a drug addiction. Now, again, those of you who want to say, you can't judge, how can you say you don't know him? There's certain things you can tell. Look, if I were sitting and evaluating him, it would be looking at his behavior across the room, much the way we do on camera. If I were evaluating a rash, I look at a picture of the rash, I can kind of tell you what the rash is if I know the clinical context. Now, there may be very specific things I can't say, but I can tell you that was somebody in psychiatric trouble, that he had a long history of addiction, and clearly when there's that kind of psychiatric symptomatology, you know the addiction is active as well. And it did not seem that he was interested in getting any treatment at that time. And back then, I think it was about 3 years ago, I said, this young man is going to die of this disease too. There's going to be another death. So everybody, Whitney Houston around, again, same problem. Her daughter, same problem. His boyfriend, same problem. These are deadly diseases. Even when they are treated, they are deadly. And you've got to remember that it's not one treatment and you're fixed. On average, it's about 4 to 8 treatments for a given individual with addiction, depending on about 3 or 4 years of trying to get and stay sober before somebody gets a year of sobriety, depending on what data you look at. And these are serious illnesses, and this is what we're dealing with on the streets right now. So unless we get very realistic about that. Bobby Christina, thank you very much. I think that's correct. That was the name.
Thank you.
Let's see. Yeah, it's really sad. I agree. It is a really sad story. And what drives me crazy is that these are all treatable conditions. Tanya, you're asking about ketamine for psychiatric disorders. Other than depression. So ketamine has been shown to be very effective for depression, particularly recalcitrant depression that has not responded to other treatments. Other things besides, I'm not sure. I'm not sure what to say for other. I'm not of opinion about that yet. I'll look around, see what the literature shows. Yeah, thank you, Kari, who's 26 years sober. And me too. You said she's 26 years sober and seen a lot of things come and go. I've been working in the field for 35 years, and I've seen a lot of ideas come and go. That's why I'm skeptical whenever they come up with the new cure for, this is going to be the solution. The thing that has worked always is this interpersonal mutual aid, also known as 12-step. That's one version of it. That works when it's done properly. It's hard to do. That's the problem, and that's why people fall out, and that's why people have difficulty. So they need other things to make recovery possible. All right, Mr. Producer, how are we doing here? Are we?
You did 20 minutes. That was pretty fast. Huh?
That went fast. So,
wow.
All right, I hope that was useful for everybody. And again, we're just starting this thing, so I'm just kind of getting a feel for it. If there's specific topics. Is there somewhere, Ms. Producer, they can send specific things?
Well, they can call in to Dr. Drew. Ask Dr. Drew on Sunday. Just go to drdrew.tv and sign up for the notifications when we launch, and you'll just click through to the number and come straight on the show to ask your questions.
Do that, or go sign up at the drdrew.com/contacts, and it's your emails, and I'll try to maybe bring some emails in here for this thing too.
Yeah, maybe, but we like the calls now. So
well, and other suggestions, whatever. How was the meeting with Robert Paul Champagne? This is the Dr. After Dark world, your mom's house. Do check out Dr. Drew After Dark. We now have. I just got an email with the video of the house tour. I've not seen it yet. So the Robert Paul Champagne interview is up at your mom's house, and next is coming the house tour, which, from my perspective, was the more extraordinary part of the visit. So we'll see what that looks like.
We also have a best of Dr. Drew After Dark up this week, and also Tom Segura from last week. So go ahead and catch up on YouTube and on the podcast that you listen to. Go to drdrew.com. You can find all the links.
Two things. Yes, calling on Sunday, Monique. Irma. I'm familiar with Dr. Dan Amon. I've known him for years. I like his stuff. He's a good person and working hard to try to help people. And then Kitty, have a great day, you say, and I think that's a great way to wrap this up. Let's try. I'm gonna try to stay more positive in 2020. Let's try to be more collaborative. Let's try to heal things rather than be adversarial. I think that's how much has this adversarialness helped? What has that done? Nothing. So let's kind of get together on things. Let's find common grounds. Let's have a good 2020. Let's have a great day, and I'll see you tomorrow. Well, I'll see you on Sunday.
Yeah, no, let's do it tomorrow.
Oh, doing tomorrow.
Why
okay,
not?
We'll see you tomorrow around the same time.
Okay, how do we turn this on? Sorry. I'm still on, Drew. Sorry.
Okay.
The mouse isn't working. It won't let me hang up.
Well.
Why isn't the mouse working? Oh, no.
We can't shut this thing off, so we'll have to stay here the rest of the day. This will be very interesting.
The mouse is... Oh, I have this, wireless mouse. Okay, there we go. Bye, everybody.
Okay.
Yes. It wouldn't work.